take their seat, and we'll get ready for our morning to begin. Now that's a sight. I'd like to welcome all of you to the Genesee Valley Equine Clinic Winter Horse Health Seminar. It's always so much fun to come here and see faces that I've seen last year, 5 years ago, 10 years ago, 20 years ago, and this year, I have to say, 30 years ago. We've had quite a ride here at GVEC, and thank you all for being such loyal supporters, coming up to this seminar year after year, coming here to learn, perhaps take home a door prize or two, and browse our exhibits, and enjoy some of our nice refreshments, care of a bakery cafe. And I think we have some very nice continuing education for you this morning. Before we get started, I'd just like to introduce the roster of veterinarians that are here, because we have some new faces and some wonderful faces this year. Dr. Pacheco will be talking to you. I'm going to ask her to stand up in a few minutes. Dr. Pacheco is joining us from Brazil, and so she brings a little international flavor to our group. Dr. Joan Ayers. Joan is celebrating her 5th year with us this year, and Joan, you all knew her when she was an intern, and now she's very established as a clinician here. Dr. Amy Snyder. Now, Dr. Snyder is manning the pager today, doing emergencies, so if she's not here, you know there's a reason why. And I'd like to thank our sponsors this morning. We have a number of people who have come out to support us, and they have every year. Our corporate sponsors, Bayer, Boehringer Ingelheim, Luitpold Pharmaceutical, Mariel, Pfizer, and Platinum Performance. They're all at the gym right as you come in. Our distributors, Butler Shine, Patterson Veterinary Supply, MWI, and Mrs. Pasture's Cookies for Horses. And our business sponsors, Barnard Chevrolet, Blue Seal Feeds, Cargill Animal Nutrition, Davis Trailer World, DJM Equipment Incorporated, Franklin Williams Company, Palatech, and Triple Crown Nutrition. And we have a number of local businesses, local horse clubs that are scattered around the gym, and we know that you will have some nice time with them, spent browsing their exhibits, looking at the things that they do for the horses in our community, and being very, very proud of all the horse activities we have here in the Genesee Valley.
I am going to introduce Dr. Pacheco, our next speaker. So as Dr. Dwyer already mentioned, Dr. Pacheco is originally from Brazil. A little background on her: she graduated in 2005 from, hopefully I will say this right, the Universidade de Uberlândia in Brazil, and then she did her internship in Canada at the London Equine Hospital. From there she went on to Tufts University, did an internal medicine residency, which is a pretty rigorous program for 3 years at Tufts, and ended up staying on as an emergency clinician there for a year. And then we were fortunate enough to have her come to GVEC with her expertise, and she is going to be speaking to you about performance problems in your horse. And as you'll find out, it will cover a wide variety of things. So here's Dr. Pacheco. Everybody hear me? Okay. Thank you very much, Joan. Thank you, everybody, for being here. So we're talking a little bit about poor performance, and one thing that everybody knows is that horses are amazing athletes, and we're going to be going over why they're so good athletes. And just to start, horses can run very fast. Racing thoroughbred will reach speeds of 40 miles an hour. While racing quarter horse can get to 55. So more than a racing dog, much more than Michael Jensen that could get to 27,
miles per hour, and not as much as cheetahs, which are the fastest animals in this planet, and they reach 70 miles an hour. Horses have a lot of endurance. You know that Arabian horses can trot for 100 miles in half a day and can go through pretty tough terrains like this horse here. They're very fit animals. This is VO2 max, which is oxygen consumption, so it measures fitness. So how much oxygen is your body taking and using per kilogram, so per weight per minute. And you and I probably have a VO2 max of around 40, and Olympic athletes will get to 80. This is Oscar Svensson. He is a Norwegian cyclist that had the highest, always measured VO2 max in humans, and he got to 97.5. And racehorses will get twice as much, 200 amounts of oxygen, and this is per kilogram, so it's adjusted to body weight per minute. So they are extremely fit and can use a lot of oxygen. They're strong. It's not unusual for a pair of draft horses to go 10,000 pounds. They can jump. This is their highest jump. This is Wasso in 1949, jumping a fence of 8 feet, 1 inch and a quarter, actually. So this was 1949. And this is Pusson's, competition that the horse that wins is the one that jumped the highest fence. And they can easily get to 7 feet. They can swim. They can fly. This is a lip zunner that is doing a caprioli. And they can also dance. Sorry, just to wake everybody up. Matinee, they were the Western Games in 2006, and it's an amazing dressage horse that unfortunately passed away, but she's extremely amazing for sure. So why are they so amazing athletes? And we'll go a little bit about their particularities of their systems and physiology, why they're so good. And first you have to understand a little bit of what is exercise. Exercise is movement of bones and joints, and it's caused by contraction of muscle right here. And the fuel for the muscle to contract is oxygen. Oxygen comes from the atmosphere, but it comes through the respiratory system, then reaches the blood vessels, and it's pumped by the heart into the muscles, so you can have that exercise. So those three systems that I'm talking here, so respiratory, cardiovascular, and musculoskeletal, is going to be the most important for exercise. And we'll go back to this in a second. So now I'll talk a little bit of particularities of each of those systems. So the respiratory system can take in quite a bit of air. So at rest, the horse usually breathes about 15 gallons of air per minute. But this increased to 475 gallons of air per minute at maximum exercise. Down below is just the percentage of the body weight that a lung, like in men, dog, and horses. So it's pretty similar size. So men is 1.4% of the body weight is made of lung, and a dog is 0.9, and the horse is in between, so 0.9 to 1.5. So their lungs are not much larger than the man and the dog, but it's definitely much larger than a cow. A cow is not an athletic animal, as you know. Sorry, that's a little bit dark, but moving to another system, the cardiovascular. So the heart, horses do have big hearts, and that is true. So humans, again, comparing to body weight, so 4 grams per kilogram, which is 0.4% of their body weight, is heart. In horses, it varies from 0.9% to 2%, so reaching like 20 pounds of heart in the thoroughbred, and I'll talk in the next slide as well. So that difference, the 9 to 20 grams per kilogram, is depending on breed and use of horses. So ponies and maybe horses that don't perform as much exercise, they have a smaller heart compared to their size, while racing thoroughbreds will have pretty big hearts, and I can show you on this next slide. So the heart of Secretariat was definitely one of the largest heart ever weighed before. It weighed 22 pounds. And it actually was able to pump 132 gallons of blood per minute when he was racing. And this is 10 times his own blood volume in 1 minute. So the picture below is on your left here is is the heart of a racehorse. This is not Secretariat's horse, but it was definitely a pretty fit horse that had a quite large heart. And there's also a thoroughbred stallion, so it's the same breed, similar size, but much smaller heart of a horse that's not competing. So heart size does change with exercise, and we also believe that some genetic component that horses with big heart will run faster. And I know we're talking about cardiovascular, so you might be asking, like, why I have a spleen here. The spleen is very important because it's a reserve of red cells. When horses start exercising, the spleen contracts and expel all these red cells into the bloodstream. And it causes the concentration of red cells in the blood to double. So you have much more red cells, and the red cells carry the oxygen to the muscles, so you have the fuel for the muscle contraction. To give you, so below here again, you have that little chart with the weight of the organ in relation to the body weight. So in men and dogs, 0.3% is the spleen. And in the horses, it can vary from 0.2, it's usually the draft horse, to 1.1% of the body weight in a racehorse. So again, it can have 10 pounds of spleen. The spleen is very large in the horse. To give you an idea, it's about 3 to 4 feet long and occupies most of the left abdomen, the body wall. It's quite large in there, and because it has so much red cells helping the horses to be able to exercise. You probably heard, especially with Lance Armstrong talking about doping and all of that, you heard about blood doping. So this is a way of doing blood doping that's legal, right? So it becomes an own horse, their red cells just rich in circulation to carry more oxygen and allowing them to be so great athletes. So moving on to musculoskeletal, one of the things that horses have a lot of muscle. A racehorse will have 50% of body weight in muscle. They also have much more glycogen. So glycogen is a carbohydrate that's stored in the muscle, so they can use for fuel when the muscle contracts, so it's readily available. And horses also have much more of that carbohydrate in muscle than people do, so 50% more. And just as a curiosity, they do have 205 bones in their body. So I'm talking so much about racehorses, and it's easy to think that poor performance is something that only affects racehorses. And for sure, most of the research, when you're looking at those percentage of body weight and how much red cells come from racehorses, but poor performance is much more than that. Poor performance can affect any horse that performs some kind of activity. So it is a trail horse that's tripping in a trail ride. It's the draft horse that's getting tired when he's pulling weight. So it's getting very sweaty, winded, so that's poor performance. It's the dressage horse that's not doing his one-time changes. It's the event horse that is not refusing jumps, for example. So anything that can negatively impact physical activity causes poor performance. So complaints of poor performance include things such as no longer winning, which is very easy to say in a racehorse, for example. Used to running this time and now it's taking much longer. So that's easy to imagine. But it's also a horse that's reluctant to perform a certain task. So let's say a horse that's not doing his leg changes or not doing a certain dressage maneuver or refusing jumps, working collection. It's a horse that has abnormal gait, either being tripping or feel disengaged, feel uncoordinated, getting too tired, sweating too much, winded, having trouble doing the same level of exercise. A change in behavior is poor performance. So a horse that used to like to work and now it's really cranky, and so those things are all poor performance. Maybe not accepting the vet, those are all signs of poor performance. So going back to that slide that we talked about, the 3 systems that are most important for exercise. So sure enough, the main cause of poor performance are related to those 3 systems, and those are in order of the frequency. So most commonly they have a problem with the musculoskeletal system, usually translated by lameness. But we'll go a little bit in depth to that in a second. Second cause of poor performance is a disease of the respiratory system, so what's bringing the oxygen in. And the third one would be disease of the cardiovascular system, so especially heart, that's pumping that oxygen to the muscles. In the end, and we'll talk a little bit more about it, the whole body has to be working well. Of course, if a horse is colicky, he's not going to be able to perform, or if he has other disease that he might be pre-evident at rest, he won't be able to perform well. But those 3 are the main causes of horses that look completely normal at rest, but then maybe not exercising properly. So musculoskeletal system, we can think about bones is one of them, and it's pretty obvious that a fracture would cause poor performance. There's a type of fracture that is a stress fracture that it might not cause severe lameness, and that happens more in a racehorse. That will cause maybe mild lameness or even no lameness at all, and again, once they are at full speed, they might then have a catastrophic fracture. More common than fractures, disease that's related to bones, is actually joints, would be arthritis. So arthritis is something that happens with wear and tear, and it can happen in a very young horse that's been exercising very intensively, but mostly happens with a lot of horses, and especially as they age. Dr. Paradis will talk a little bit about as the horse ages, but that's a problem that affects a lot of horses that I'm sure you have right now. So this is an example of a radiograph. So this is lateral radiographs of the distal extremity of the horse. So here's the coughing bone down here, short pastern and long pastern. The pastern joint is right here, and this is coughing joint. This is a fairly normal pastern. This is a horse that has mild arthritis, and you see that by seeing that little lip right there. So that bone reaction is a sign of arthritis. And the third one has a pretty severe arthritis link right there. So the horse in the middle that has mild arthritis might have a mild lameness, and for sure the one that has severe arthritis like that will have a trouble. Even you might see it on the pasture, is going to be limping and all that, so affect quality of life in general, not only performance. And things that we say, what is your heart trying to tell you? So we're talking about signs of those diseases, so you can keep an eye on. And this one is, of course, will cause lameness, is one of them, audit and poor performance. But you might see joint enlargement, because there's fluid accumulation inside the joint because of that inflammation. And you might also, if you're trying to bend the leg, let's say you're trying to pick up the hoof and all that, the horse will be painful, not want you to do that. So those are signs of arthritis, which is definitely probably it is the number 1 cause of lameness, especially as they age. So for musculoskeletal, from bones, we're going to move to muscle. The main sign of muscle disease is tying up. So tying up is when they get stiff after exercise, they might be sweating, it might look like colic, they get quite uncomfortable with their muscles hurt. And there are 2 long names in there. Those are 2 diseases that predispose horses to have tying up. One is the disease of thoroughbreds, the recurrent exertional rhabdomyolysis, and for short we call RER, but that is mostly for thoroughbreds. And the polysaccharide storage myopathy is probably what you heard about, the PSSM. It's that disease that we keep saying, oh, if your horse has it, has to increase the amount of fat. Again, I won't be talking too much about treatment because we probably couldn't cover all of that, but PSSM is that disease that affects a lot of draft horses, quarter horses, but can affect any breed of horse as well. So signs of muscle disease is that tying up, so stiffness, sweating after exercise, and colic-like symptoms. However, horses with PSSM sometimes can have mild symptoms that you might not see the full-blown tying up, but they might not be performing very well, and that might be somewhere that we would look. So to join muscle and bones, you have to have the tendons, the ligaments. So tendons to join them, ligaments would be to stabilize the joint, and you also have other types of soft tissues such as meniscus and all that. So that can also cause poor performance. Just as an example here, so tendinitis, a bow tendon, such as this run like right here. So you're seeing swelling, the horse is going to be lame, there's all the initial phase, there's heat, pain when you touch it. And this is the bow tendon, which is tendinitis of the superficial flexor tendon, which is the one that's in the back of the cannon bone as it's showing in there. So other than the signs, what we usually do is ultrasound that tendon to see how severe it is. And here's a picture of the ultrasound to show you. So here is the superficial flexor tendon, so the one all the way in the back of the cannon bone, which is the one that's swollen right here. That's the next tendon closer to the cannon bone, so division flexor tendon, check ligament, and suspensory. So there's several structures in the back of the cannon bone. And then just so you have an idea how tendinitis look, so tendons should usually look like this. It's very homogeneous and white, and you can see this area here is nice and white. But the entire tendon is what is in the circle right here. So this darker part is where the tear. So this is the tendon tear of the superficial flexor tendon. We cannot forget about the back. We talk so much about musculoskeletal and we're thinking about limbs and lameness, but there's more to it. And the back has both, all of those, right? So it has bones, which is those projections from, well, we have the spinal, the vertebrae, and then you have the process, which is those projections. I'll show it to you in a second. So you have bone in there, and you have ligaments in between those spinal processes. A ligament on top of it, and muscle. Sorry, I don't have a picture, but it has all those three components of the musculoskeletal system. In signs of back pain, I think like horses resentment to settling, or when you're mounting the horse, a stiff back that can be felt by the rider, but sometimes when we are lunging the horse and watch them go, we'll see they have no movement through the back at all. Pain on palpation, and palpate the bone and also the muscles. You can have an uneven gait, so maybe a little bit short-strided behind, maybe a very mild shifting lameness, but it does not usually cause severe lameness. So if you have severe lameness, and that's why we want to watch the horses go, if you have severe lameness, you have to find another cause. So sometimes it starts as a hind limb, let's say a hop arthritis pain, and they travel differently, that then leads to their muscles in the back stiffen up and have a problem. So it's very important to do that distinction. What is the primary problem here? And as I put that picture, if you have a horse that used to be a very nice horse and all of a sudden is acting like a rodeo horse and is bucking you off, back pain is something to investigate for sure. Sorry, and the most common cause of back pain, other than muscle soreness, would be the kissing spine. I decided to put a little bit more dramatic example here for you, but this is fractured withers. So, so those are the finger-like projections that I say that comes from the spine. So these are the dorsospinal process that form the withers. And you can see that here it is broken. Those are normal, those two. And it broke and flipped back because this horse flipped backwards and hit its withers and broke its withers. And the signs wasn't lameness. It was very like short-gaited in front, but it would grunt every step it would take because it hurt. It also had swelling, and you know, and palpation and all of that. But these horses usually do well. I know, it's showing dramatic pictures. So just to sum up what we can do in terms of diagnosis. So we talk about signs, that's what you're looking for. Lameness is very obvious that you see a problem that is interfering with performance. But signs of back pain, as we talked about, things like swelling in certain area, pain to palpation, heat, those are all signs of a musculoskeletal problem. And then what we would do is definitely, of course, take a history before, a good physical examination, so you can palpate all the limbs and see if there's an abnormality there. And also a lameness exam. That is when we watch the horse jogging, and then we see them also usually lunge, so you make smaller circles, we can stress certain areas. to see if they are lame and which limb is lame. And then we try to localize where the lameness is coming from, which can we usually done by a couple of things. One is flash and test, which we hold the joint bent in a certain way for a while and stress that area. And then we have the horses jogging out to see if that makes them worse. And then we can also do something that's called nerve blocks, which we put local anesthetic by a nerve and we desensitize an area. And if the horse then goes down, you know that's where it hurts. That's to kind of help us guide. Is it lame? Where does it hurt? And then from there, and also I have to include palpation, not only of the limbs, but the back, neck. And we do those stretches to see if there's anything that seems to hurt this horse. So once we know that something hurts and where it hurts, we'll go for imaging, which usually is either radiographs or ultrasound or both, depending on what we see. Radiographs usually show more of the bones, and then ultrasound will also show bones, but we look a lot for the soft tissue. So when I say tendons, ligaments, and all that, ultrasound is the way to go. When we feel like there's need more information, then we can always refer for further evaluation, and some images are bone scan, MRI, and CT. And MRI and CT are quite helpful to look at the structures in the hoof. There's a lot of bones, ligaments inside the hoof that is very difficult to, or the ligaments are very difficult to image otherwise. Sometimes the signs are so vague, so let's say a horse that does not want to pick up a lead, and we do a lameness exam, that's where it would start, and we find no problem, like no lameness. But it could be somewhere it hurts that you're not finding. So sometimes we'll recommend something that's called an analgesic trial or a bute trial, where we put the horses on bute for a limited amount of days just to hopefully take the pain away. And if it's because of pain, that horse will start doing its lead changes. That's what so it's a way to differentiate. It's not going to tell you where it hurts, but it might tell you it hurts somewhere, and then make you look a little bit further. Those last three ones are more about muscle disease. So let's say if we don't find any other problem, but the horse maybe looks a little stiff, or depending on the breed, you know they're more predisposed to certain muscle disease. We can do a exercise test where we have them exercising for a short period of time, maybe about 15 minutes or so, and we measure muscle enzymes before they exercise and after. So if there's muscle destruction when they exercise, you'll be able to tell that way. The PSSM, which is that disease that mostly occur in draft horses and quarter horses, but it also pretty much all breeds. There's also a genetic test available that probably some of you might have done, and we talk about taking the hair sample out. So for draft horses and quarter horses, there seems to have a genetic component. There is a genetic component that can be tested for. And then the last one will be muscle biopsy. So this is just to give you an idea how far you can go in terms of workup for performance related to lameness, or to musculoskeletal disease, I should say. So moving on to the system that actually brings the oxygen in, respiratory system. We divide in upper respiratory and lower respiratory. Kathleen had showed you a slide a little bit earlier. So upper respiratory is nose and throat, so it's what's bringing the oxygen first going through that. It's the bottleneck, right? All the air has to go through that. And if there's an obstruction, as happened with Twinkie, it doesn't matter if the lungs are working or not, if the air will just not reach the lungs. So I just have an example here of an endoscopy, as Kathleen explained to you. So that little camera, we put up the nose and take a look at their nasal passages and throat as well, and you can go down to their trachea windpipe. And so this is one of the probably most common causes of upper airway disease. This is a normal endoscopy picture. So here you're looking at their pharynx, and here's their throat. You have epiglottis on the bottom. Those two flaps, which are the arytenoids, and here's the windpipe. So the trachea is right down here. That black hole, that's where you want the air to get into, so you can reach the lungs. A roar will have a paralyzed flap, or there's different degrees, but the most severe would be when one of them becomes paralyzed and hangs down, so makes that diameter of the entrance to the windpipe quite small, so limits the flow. which you will not influence the horse that's at rest or that exercise at low levels, so not too demanding. But will absolutely interfere with the performance of racehorse, but also interfere with polo horses, event horses, maybe horses that work a little bit harder, that need more air during that exercise. So Roar is an example of upper airway disease. Twinkie also had an upper airway disease that was interfering with her well-being at rest, so it can be severe enough to do that. So. And when we're talking about signs, so you're looking again at what is your horse trying to tell you, other than poor performance that may or may not happen, what you see is respiratory noise. So that's a classical sign for upper airway disease, as Kathleen said already. So that noise is usually a sign of some kind of obstruction in their upper airway, as they, it can be usually at exercise, but can also happen at rest. So we've talked about upper airway. The other part would be lower airway, which is talking about trachea, lungs. And something that we sometimes don't think about is that lungs is not only where the oxygen gets absorbed. There's all this tubes inside the lungs, so the airways. And you can see on this picture, this is the window that we made inside in a horse lung, and it's showing all that tree with all the branches, right? So it's bringing the air in, so the oxygen can be absorbed in the alveoli, so it has airways inside the lung. And here you have a picture of a cross-section. So we got those airways, those bronchioles, and we cut it, and it's a schematic, of course, and it's showing to you what a normal bronchiole should look like. So it has the wall like this, and it has a pretty nice and open diameter that the air goes into, so it can reach where it gets absorbed. A horse with an inflammatory condition, which can be heaves, that I know a lot of you heard about before, but there's also a milder form that I'll talk a little bit more about, which is inflammatory airway disease. But in the end, it's a little bit similar to the point that you have a decreasing diameter of those airways. So that's what happens if you have a heavy horse, that's what's going on. You have a thicker wall of that bronchiole. There's also constriction, so that's why sometimes you give someone to dilate, or if you have asthma, it's pretty similar to asthma in people. That you use an inhaler to dilate your bronchioles, because there's bronchoconstriction, that muscle around the bronchiole also constricts down. And there's mucus inside, so you have a very small airway. You can imagine that amount of effort that a horse has to make to move air through that is much more than you would move through a normal airway like on the left side. That's why you see your heavy horses breathing so hard at rest. The inflammatory airway disease, as I mentioned, is a little bit milder form, so you won't see any signs at rest. But it's a pretty important cause of poor performance. Usually it's in horses that exercise a little bit higher level as well, for you to see that. And then you see them taking a while to recover from exercise. Maybe I'll move to the next one. So here are a few signs. So prolonged recovery from exercise, breathing faster in exercise. Heavy horse, we will do that at rest, so in the stall. And you can see down here, this is what we call heavy line. So it's like a six-pack. Their muscle just got really strong. Their abdominal muscles get hypertrophied, so they have to get really strong just because they have to pump so hard to be able to breathe. So that would be a heavy horse. But again, flared nostrils, nasal discharge, occasional cough. Even that horse that when you start riding coughs a couple times, that can all be signs of inflammation of the lung. So those are the signs, and then we're coming to the diagnostics, just to do a rundown of things that can be done. Of course, history, the first one to indicate us there's a respiratory disease. Physical examination will be quite important. First, at rest, it will pay attention to the entire horse, but also concentrate on auscultation of the lung. We'll do what we call the rebreathing exam, so put a bag around their nostrils. Some of them don't like it all, just to make them breathe. Kathleen is very good at doing that, though. Pretty much any horse. we'll make them rebreathe the CO2, so they take deeper breaths so we can hear better. If there is some kind of obstruction, we'll have an abnormal noise. We also like to see those horses exercising, so if it's not a heavy horse that has signs at rest, sometimes if we lunge them and then we say, oh, it's breathing pretty hard now, and that might give you a clue that that's respiratory system is involved. And then for going a little bit further, endoscopy, as we said, and especially if you have a respiratory noise, you have to look at that throat. Some more imaging, so you get ultrasound and take radiographs of chest and lungs. And sorry, I didn't talk about pneumonia. I just went for the inflammatory conditions. So pneumonia, of course, will cause a decrease in performance. And if it's very early signs, that might be all you see. But a lot of times it also causes other signs, systemic signs. You have fever, you have depression. So as it advances, it becomes much more obvious. It's not only a cause of poor performance. While the inflammatory conditions, you can sometimes just see a change in performance and not notice so much at rest. To help diagnose with inflammatory conditions, so heaves and inflammatory airway disease, so to see if there's inflammation in the lung, the best thing to do is actually get a sample of the cells that are in the lungs, and you can do that by doing what's called a lung wash. So this is what's being done in this picture on top here. This is me and Dr. Evita doing a BAL for research that I did with Dr. Paradis. And the horse is sedated, and we put a tube that is longer than that nasogastric tube that we put in their stomach, but it's also thinner. It goes up the nose in a different pathway. It will go down the windpipe, into the lungs, and then we put fluid, but a small amount of fluid will not make them drown. And we draw back so you have a sample of the cells, what kind of cells are in the lungs, so you can see is there inflammation here, and that way diagnose inflammatory airway disease and know a little bit more about how severe it is. A little bit more advanced testing that we are currently not offering here, but something that I've worked with is a lung function test that I won't go into details, but it's a way of really measuring how much obstruction that horse has. And that's what in that picture below here, we're doing lung function tests in the field of animals. So moving on, next system, cardiovascular now. So the one that's pumping the oxygen to all that muscle so it can exercise. Signs of cardiovascular disease, I think the earliest one you see murmur or arrhythmia, so either an abnormal sound or an abnormal rhythm of the heart. That's usually picked up by us when we're doing physical examination, or if you have a stethoscope and use it to listen to horses, you might find it out. So those are the signs that usually you have to investigate further to see is there a problem here that could affect the performance, and is this horse safe to ride? The other signs, well, syncope, so the horses that collapse, it can be during exercise at rest, can also be a sign of heart disease. And the other symptoms that I put it down here is more of heart failure, so it will be much more than just exercise intolerance. You'll see those signs, but as cardiac disease progresses, it might see those. Which one is a distended jugular vein, which is that vein that we put the catheters in and draw blood from, so the vein in the neck gets distended. You might see swelling, so swelling of the most dependent areas from the abdomen, like the horse that that's shown here. Sorry, the picture is a little bit dark, but there's a huge plaque of edema right there, swelling, and it can be limb swelling, so those can be signs of more advanced heart failure, and cough, because there's going to be fluid that also accumulates in the lung. So the way we look a little bit further into cardiac disease is absolutely by listening to it first, and if there's an abnormality, we move on to more advanced diagnostics, which we usually refer for. So one is looking at the rhythm of heart, which is electrocardiogram, EKG. And then the other one is ultrasound of the heart, echocardiogram, so you can look at the heart chambers and see is there a leaky valve, is the heart too large, and all those things, is it contracting well. And sometimes you might see nothing at rest when we're talking about poor performance. But sometimes you have to make those horses exercise for you to find a problem, and that's what's going on in this other picture, where you can have them put in a treadmill and have an EKG so you can monitor their heart rhythm during exercise to be able to tell is there a problem here that only occurs at exercise. So talk about the three main systems, we said heart, lungs, and musculoskeletal. That's directly involved in exercise, which are the ones that cause most of the poor performance issues. But the entire body of the horse has to be working well, and one of them is the neurologic system. So just touching a couple of other systems. So neurologic disease, usually what you'll be looking for, so what your horse is trying to tell you when it has a neurologic disease, will show incoordination, stumbling is a possibility. You might have muscle loss in a particular muscle group, but not entire horse. So those are signs of neurologic disease. I put a few examples of the most common ones. So wobblers and neck arthritis. Those two both cause spinal cord compression, right? So it's just compressing the spinal cord and makes them incoordinated. And there's a few other ones. EPM can do that, and also the viral encephalitis. So the triple E, West Nile, Western encephalitis, all those can cause neurologic disease leading to incoordination. In terms of how we would diagnose that, for sure history is important. Going back on physical examination, neurologic exam, we evaluate their gait. So we'll see mostly at the walk, you look at just a straight line, and then you start making it a little bit more challenging, going up and down hills, turning very tight circles, backing up, and we're looking how coordinated, how well they place their feet. Do they know where their feet are? Also looking for signs of weakness. Okay, so like a tail pull here. So does the animal know where the feet are? Is it strong enough? So those are things that we're looking for, more subtle neurologic diseases. And then from there, depending on what you find, and you localize where the problem is, you'll move to more diagnostics, either like neck radiographs or testing for specific diseases. And then I had to put it in here, gastrointestinal disease, as I said. Colic, of course, will affect, but one of the ones that are a little bit nebulous is gastric ulcers. You can have very subtle signs, such a horse that's a little bit picky eater. You might have a horse with mild intermittent colic signs. Sometimes they don't have a lot of signs. Of course, might be a little cranky. So those could be signs of gastric ulcers, and we know it's very prevalent in horses. Racehorses, up to 90% of racehorses can have ulcers, and it's also a disease of pleasure horses. Up to 60% of horses can also have gastric ulcers. This has a lot to do with the way we manage horses nowadays. So intermittent feeding. Horses secrete gastric acid 24 hours a day, so they're supposed to be eating most part of the day. And the way we change them, do like intermittent feeding, so feeding small, like larger amount of grains twice a day or so can predispose them to gastric ulcers. And there are a few other things. Of course, the stress is related to it. And the grain itself can also have certain substances that are pretty tough on the stomach itself, leading to ulcers. So this is a gastroscopy picture. So it's an endoscope that you pass this time from the nose into the esophagus and then into the stomach. And you can look at the stomach. And there's a normal picture on the left. So it's normal for them to have this darker red. This is where the acid comes from. And this is the lighter squamous mucosa on the top here. And that's where they get most of the ulcers. So this is a normal stomach. This is a stomach that has gastric ulcers. So you can see that light pink mucosa is now sloughing off. And you can imagine that's not very good. However, a lot of the gastric ulcers are silent. And there's still debate on how much they interfere with performance. Of course, the horse is showing signs and it's colicky, it affects its life in general, but some horses will act quite normal, see how it ulcers. So when we talk about all those signs, so poor performance, and then you have to look a little bit further. Is this horse lame? Does it have signs of maybe it could be respiratory disease? Is this horse coordinated? Does it have anything else that points to heart disease, or on physical examination can you find that? So then it will come in here, your history, which would be very important to leading us the right direction, so where to look further. A good physical examination will help us decide again where to look. And a A lameness exam is very important as it's the leading cause of poor performance. And then you can go to imaging if you have to, endoscopy if you have concerns about respiratory system, particular blood work depending on what you're looking for. Looking further into heart with EKG and echocardiogram and lung wash. So those are the basic diagnostics, how far we can go in the field to try to find out what is the cause of poor performance. So a few things that I want you to remember from this talk is that disease of any body system, body system can cause a decrease in performance. Usually the systems that are most commonly affected are respiratory, musculoskeletal first, then respiratory and cardiovascular third. Poor performance can be an early sign of systemic disease and should be investigated. So even if you're saying, oh, I don't care if I win or not that competition, my horse is not a competition horse, why would I care if it's not exercised at the same level? It's because it can be an early indicator of something that might be progressive, that it might be able to pick up a little bit earlier and find something that would interfere with his well-being overall. And of course, the more demanding the exercise, so horses that need a lot of that option will show signs with milder disease. And while a horse that may be showing something in the pasture will have more severe disease, which is usually easier to find. But just to give an example, as poor performance is not only something for racehorses, I received a horse that one of the complaint was that this horse was used to lead the pack in the field. So they used to say this horse was always the one in front, galloping around the field, it's very happy. And they noticed that the horse started staying behind and just trotting behind everybody. And this is a sign of poor performance. And when you look a little bit further, this horse had a heart abnormality and in that way. So again, not only for racehorses. And I think I went a little bit fast, so I have some time for questions. I'd like to thank everybody for being here.
If everybody's ready, it is my honor to introduce you Dr. Paradis, my mentor and friend. She graduated from University of Georgia and then did her large animal internal medicine residency at University of Washington and finished in Michigan. And then went on to private practice in Long Island and joined Tufts, where she's been for almost 30 years teaching students and interns and residents, and of course taking care of patients as well. She has a passion for both the young horse foals and also the geriatric horse that she's going to be talking to you about today. So her talk is the geriatric horse, what to expect when your horse turns 20. Welcome.
So you can see that my title's a little changed from what's on the program. It's mainly because I was reading in the AARP, yes, I'm a member, this article on what to expect when you turn 60. Well, I thought, well, that's a great title for a horse talk on geriatric horses. So what do you expect when your horse turns 20? And so I always like to start my talk with asking, how many in the room have horses that are over 15? Whoa, everybody, good. How many have horses over 20? Excellent. 25. Wow. 30. All right. 35. 1, 2. All right. Well, horses, it seems to us like they're living longer and longer. So I'm going to talk about several things that we see as your horse ages. And I'm going to talk a little bit about all body systems so that you kind of get an overall view. I'll spend a little bit of time on probably the most specific disease that we see, or equine Cushing's. But I think that last year you had a very good talk on that topic, so I'll touch on it, but I'm going to spend most of my time on some of the other aspects of aging in the horse. So how many horse years are in a human year? And it's difficult to know sometimes, but to study the geriatric horse, you have to really define what is old, or when the horse starts to age. And one researcher suggested that a 25-year-old horse corresponded to an age-related changes in a 71-year-old human. Now in human medicine, certainly the concept of aging, or the definition of aging, seems to be changing a lot as humans' lifespan increases and people are active into their 70s easily. And so we may see some of that happening in the older horse as well. Certainly, when I was growing up and riding horses, when a horse hit the age of 20, you retired them. And nowadays, we see horses actually working quite vigorously in their 20s. And in a survey of owners of geriatric horses that we did at Tufts, we asked them when they thought their horses were starting to age. And what the average or the mean age that they said they generally considered old was about 22. They were just first noticing aging signs at 23. So probably that's more of where we want to say geriatric begins, in their early 20s. Now, a lot of the research has looked at older horses, and they actually will start at the age of 15. To me, that's cheating. A 15-year-old is still winning Olympic gold medals. And so to me, at least 20 and maybe 22 should be where we start to say geriatric or elderly horses begin. And we also asked the owners when they thought, how old a horse would they think about not buying because of age. And so the average age was a negative concept of purchasing a horse was about 16 and a half. So if you turn that around, people felt like if they bought a 16-and-a-half-year-old horse or a 16-year-old horse, that they felt there was plenty of life and use in that horse still to work with them. So that's how I kind of focus most of my research on the above 20 years old. And you'll see that I have pictures of some older horses here. When we did the survey, I asked the owners to send me pictures of their horses so that I could see what they were doing and how they looked. And so I did get some beautiful pictures. Here's speculation at age 25. We also asked owners how long they had owned their horses. And you'll see that the older horses were owned for almost 13 years, and the younger horses were more like 6 years. And the number of years what age did they obtain their horses? 13 for the older and 6 years for the younger horses. And the number of years that they were with the current owner is about 13. So if you look at the old horse that was bought at almost 13, and they had the horse for 13 years, so that makes them around 26. And the younger horses, they'd only owned them for about 6 years. So that puts them around 12. Horses have that, as opposed to dogs or cats, horses often change hands with owners in their earlier years. So it's when you get these horses that are finding their forever homes that you see them owned for more years with the older animals. So the big question in my mind was, were we seeing an increase, because the concept of aging seems to be creeping up in number of years, from 15 to 20 to now 23, is it that horses are living longer than they did before? And that's really hard to know because we don't really have the past versus the present of how long horses lived, or what percentage of horses lived after 20 in, say, the 1950s versus what percentage of horses live after 20 now. Several studies have tried to look at that, and when we first started looking at the geriatric horse, we looked at the percentage of our population in the hospital that were horses over the age of 20. And what we saw was that in 1989, the percentage of horses in our hospital referral clinic was 2.2% were horses over 20. And 10 years later, the percentage of horses that were over 20 was 12.5. So it's almost a six-fold increase in the number of old horses coming to a referral clinic. Now, obviously, there's a lot of variables in there, and you can't make a correlation that horses are living longer. You can say that maybe owners are having more discretionary income to send an older horse to a referral clinic, or maybe there's an increased number of owners who have older horses that want to send them, but it doesn't necessarily mean they're living longer. In Australia, a study was looked at the percentage of horses over 15 in the population, and they said that a third of the horses in Australia that they surveyed were over the age of 15. So that's a large number, 30%. In here, it was almost 100% of people who had horses over the age of 20. So this might be a skewed population. And then we were interested in what the older horse was doing now. Were they just retired? Were they set out to pasture? Or were they actually actively working? This little pony is 30 years old and still jumping. So we looked at what they did in their past life and then what they were doing now. And we saw that we had a lot of competition horses in their younger years, a lot of pleasure horses, a few school horses, and very few retired. And then as they got older, now we had 10% of the horses were still showing, which to me actually was a high number. So 10% of your horses over the age of 20 are still competing. More horses were doing lighter work in a pleasure situation, and certainly more horses were retired if they were over 20. I don't know if any of you do competitive trail riding, but this was a very famous horse, Elmer Bandit, and he was completing his last 60-mile competitive trail ride, and he was 37 years old. Unfortunately, we've lost Elmer in the last couple of years, but to me this was an amazing accomplishment that the horse could go that far. So what are some of the medical problems that you might encounter in this older horse? Well, just as Dr. Pacheco was saying that the whole body is important in the performance of the horse, all body systems are affected by age. And so if you look at it, we're going to start to see things like cataracts in the eyes. You're going to see the fuzzy pony or the fuzzy horse that has endocrine problems called Cushing's disease, or the technical term is equine pituitary parasitic dysfunction, or PPID. You'll see animals with musculoskeletal problems, tendon degeneration. You'll see a lot of arthritis, as you referred to earlier. This is a picture of a 40-year-old horse's teeth, and so you're going to see obviously some dental issues. Colic in the older horse does occur, and certainly we see tumors or neoplasias in the older horse as well. So we'll start talking a little more specifically about how common some of these things are and what you might expect. So if you are looking at the older horse, and we went through our hospital population and we looked at why were the horses presented to us, and then we looked at our survey population and we asked, different, did you have musculoskeletal problems? Did you have gastrointestinal problems, dental problems, endocrines? So we were able to look at a survey of both animals who were sick coming into the hospital, and we were looking at, quote, a healthy group of animals who live on the farm. And what we found was that the digestive system and the musculoskeletal systems were the most prominently affected in these animals. So those are the areas we're going to start with first. And then if you looked, so that's looking at body systems. And if you look at specific diseases, of course, the PPID, or Cushing's disease, is the most specific disease that increases with age. So, in this article on what to expect when you turn 60, they broke it down into the good news, the bad news, and what's that all mean. And so I tried to do that in this talk. So the good news is that most geriatric horses are in very good body condition scores, and they don't need special nutrients as they age. This is Frill, who was actually one of our teaching horses, and she lived to be 31 years old, and you can see that she's, besides the graying of her face and maybe a little bit of a sway back and belly, but she's not an athlete. She lived out in the pasture. When we ask owners to body score their older horses, you know, when I think of old or very old, I think of thin and frail, and I was really quite surprised because when we ask the owners, and of course they're rating their animals on a body condition score, which is not always the same as maybe I would rate them, but this has been confirmed in other studies as well. But 68% of the older horses were rated as moderate to good body condition. And 28% of them were actually noted to be fat or very fat. So if someone's going to tell you that their horse is fat, then you know it's fat. So usually they're not going to admit to that. And only 4% said that their animal's body condition was poor or very poor. And so that was a surprise to me. I thought that the older horse would have more problems keeping on the body condition or the weight. Because, as someone pointed out, that older horses seem to be more picky about some of the food that they eat. And you have to kind of cater to them, more or less. The not so good is that as the horse ages, their teeth become shorter and they become unable to grind as well. And so this is going to affect what we feed our horses and how much they can digest. So that's one bad news, is that dental problems in the older horse. And the other bad news is, or maybe I should say the not so good news, is that colic is one of the problems that the older horse, the most common problem they would present to our hospital at. Okay? And so colic is indeed a problem. And they have special colics that we see more often than younger horses that we're talking about. So let's go back to the teeth. And as you probably know, horses have what we call hypsodont teeth. And so when they're babies or young horses, their teeth are very long and they extend way up in the sinuses. If you take an x-ray of a horse's sinuses, you just see it full of tooth. And then the teeth erupt and they wear down so that, and it depends on what they're eating, but forage or sandy soil, things like that will wear them faster. And they lose about 2 to 3 millimeters in length each year. So the teeth come out of the sinus. So if I took an x-ray of an older horse's sinus, it'd be full of air and not full of tooth. So this continues until about 20 years of age, or until the tooth is completely erupted out of the jaw. And that's when we start to see problems. When we surveyed owners, I'd say approximately half of the older horses received routine dental care at least once a year. And a third of them actually had it twice a year. And that's what I usually recommend, at least examining the horse's teeth who's over 20 twice a year, because they can lose a tooth and you might not even notice it. And that's going to have consequences down the road. And 11% of the older horses did not receive annual care, even annual care. And we compared some of these, on the survey, we compared it with the younger population that was in the same barn. And younger horses, only 2% in. So what we were starting to see as the horse ages, maybe the normal maintenance care of the horse decreased. And so teeth are going to be a very important aspect of their health and well-being. So this is something that we should, at least once a year, and in some cases twice a year, look at. You can see, if you look at the angle of the horse's teeth here, as they get older and older, and they go from a nice sharp angle to a more buck teeth kind of configuration. So here's my 43-year-old. She's actually actually this is, you know, the old saying, boy, he's really long in the tooth, meaning that you get pretty old. That really tells you how long the teeth are. Older horses, now we're going to jump over into colic, but we're still talking a little bit about the teeth here. Older horses present for a large number for large colon impactions. Now, large colon impactions can occur because they haven't ground their hay down enough. So you have these large fibers going into the large colon instead of the kind of nice soupy stuff that gets in there. And so then they become constipated or blocked. And so colic can certainly be directly related to bad teeth. And so this is important. Also, a lot of the esophageal chokes that we see will occur in the older horse. Again, they can't chew that hay fiber down, and so they'll get wads of hay in your esophagus. And this is going to be present to a horse. Your horse would be very anxious. You'd see them kind of gagging. You'd start to see green food material and saliva coming out of their nose. And this is an emergency situation. And if after you've got through the choke and you've supported the animal, the next thing you need to do is make sure you look at the teeth. So some of the signs of dental disease that you might get an early indication are that maybe there is some weight loss going on in this horse. You'll notice quids in the stall, and quids are these little chewed up hay balls. So they get hay in their mouth, they chew, and they just can't quite get it where they want it, and they spit it out on the floor. So if you start to see the evidence of little wads of hay around their feed bump, then you know dental problems are probably involved here. You also can sometimes get a foul odor to their breath, and if you look at their manure, you're going to have, especially if you feed something like a sweet feed where you have corn or oats in it, you'll start to see the grain in the feces or in the manure, because they haven't chopped it, their teeth haven't ground those holes or the husk off of the corn so that the digestive enzymes can get to it and digest it, so it just passes undigested through the intestine. If there's pain associated with a bad tooth, or they have such abnormalities in the teeth that they can't do the normal grinding motion, which is in this kind of circular motion, then you may see that they're reluctant to eat. And again, the esophageal choke. So this is a lateral x-ray. So we take an x-ray like this on a horse's teeth, and it should be nice, two arcades that meet, and what we see in this one, we have a tooth missing in the lower arcade. So you can all see that big empty hole there. So this is the lower, the bottom teeth, this is the upper teeth, and you can see that these teeth on the top are longer than the teeth on either side. And what happens when you lose a tooth is the tooth above it continues to grow down. And if there's nothing there to grind it, to level it off, it becomes longer. So you have this big spike that is kind of in that empty spot. So can you imagine what happens when you try to do that grinding motion? You have this kind of stop there, so it makes it harder for them to grind. And a lot of times owners are unaware that this is a problem. And in the animals that came into the hospital, only 8% of them were really presented for dental problems. They're usually presented for esophageal choke or for colic. And so any horse over the age of 20, it's a rule that you make sure that you look at the teeth, even though they're presented for something else. The first molar, this is another lateral x-ray, but this is where we have a horse that's, here's the bottom arcade, here's his jaw, and this is the top one. You can see there's no roots up here. This is all sinus full of air. But this horse has lost a tooth on the upper arcade, and this lower tooth is growing into that area. First molar is the oldest tooth in the head, and so it's often the site of wearing or increased wearing or dental disease. And there's a couple names that your veterinarian might talk to you about. There's the wave mouth, so you have the arcade that middle one. Let's see if I can do it here. The wave mouth is when you have the dental arcade is actually looks like a wave. So you have more than one tooth in the middle that is higher than the others on either side. And a step mouth is where you have one tooth that's gone and one tooth grows up into it, just like one tooth creates a step. There's another one called smooth mouth, and smooth mouth occurs in the normal wearing down of the enamel ridges of the teeth. If you were to look at a horse's tooth in a young horse and look at the surface, you'd see there's a tooth, but there's this ridge that kind of goes in on top of it, and it's enamel, and it's very hard, and that's what uses to grind all that food up. And so as that wears down, you're going to actually, as they get older, you're going to wear that off so that you're actually down almost to the roots of the tooth now, and that's pure enamel. So if you think about, instead of grinding ridges, you have two porcelain plates trying to chew food. They might mush it or mash it, but they can't grind it. And so that can happen in the normal older horse that doesn't have, who's had great dental care all through its life, and you couldn't have done anything better. But it still results in decreased digestion. So if you look in there and you actually see two teeth, what looks like two teeth instead of one, it's actually you've gotten down to the roots, because remember, the tooth has maybe 3 roots in it, and if you've worn down to the top of the roots, it looks like you have 2 different teeth there, or 3 different teeth. So what can you expect as you have dental deterioration? Well, certainly if you have the dropping of food, you have the whole grains and manure, weight loss, then you need to think about changing your food to something that's more digestible and easier to chew. Unfortunately, aggressive dental work may not help these animals with the digestion, and particular foods are going to be really hard for them. So real stemmy hays they're less palatable as well, so the picky horse may not like that, but they're also harder to grind. So a nice leafy hay, if they can still eat hay, is a good choice. If you take your hand and you put it in a hay bale and you scrunch it and it hurts your hand, it's too stemmy for the older horse. If you can crunch it and it's really soft and it has lots of leaf, then that's going to be more appealing. If you smell it, it has a nice smell to it, that's going to be more appealing. And they've actually done studies on food trials with different horses and different types of hay. And the one that I was very interested in is they actually gave owners different hays and said, which ones do you think the horse would like the most? And it came down to the softness and the smell. And so if it smells good to you and it's soft to your hand, then your horse is probably going to like it. A lot of times we'll go to the complete feeds that contain forage. If your horse can't eat hay very well, the forage is chopped up enough so that, and pelletized, so that they still get that roughage which they need for digestion, but they don't have to worry about the teeth. And you can think about supplementing with grain and with different supplements as well. So let's talk about the different types of feed. And I know Neutrina's with us, so they pitch in if I say something wrong. But essentially, you've got 3 different types of grains that you can feed horses. You have the textured, which is like a common sweet feed, which has oats and corn and molasses and things in it, such as this. Whoops. Doesn't like to go backwards. Which is like this one here. You also have pelleted feeds, which is more like this, and it's they're often very hard pellets, and so you can imagine horses might have some trouble, especially if they had any pain in their teeth, mushing those. And then you have something that's called extruded. We'll talk about that. But let's say you take corn, raw corn, in your sweet feed mixer, and you say, how much of that can be digested in the horse's small intestine? Probably only about 29%. But if you take that same corn, and then you mix it and heat it and put it in a pelleted form, the digestibility increases to 49%. If you take that same corn and you put it in an extruded feed, and we'll talk about what makes an extruded feed, 90% of that corn is digested. And if you think about it yourself, if you're eating even corn on the cob, the digestibility of that corn on the cob's okay, but not the best. Then you can say, well, let's get some green corn, and so we have that's cooked a little bit more and mushed up a little bit, so your digestibility is going to be better there. But what's the best digestible corn? Doritos! Absolutely! True. But I was going to say popcorn. So popcorn, you pop it, and it has all that surface area for your digestive enzymes, and it's all available, so a popped kernel is going to be much more digestible. So if you think about extruded feed as popped feed, that's what happens. So they cook the feeds together, in a pressure cook, and then they pop it with a honeycomb texture. So it's under a kind of a pressure, and so you get a lot of little crevices in here that digested enzymes can get at, and so that's why you can have a higher digestibility. Sometimes this creates a lower density food. So think about the corn, solid corn versus the popcorn. Popcorn's really light, solid corn's a little heavier. So the problem with that might be that if you feed by volume, you'd be feeding less to that horse, right? Because it's lighter. So you need to feed by weight. So sometimes you can feed more, you'll give extruded feed at the same quarts that you were feeding the higher density sweet feed, but you're feeding less calories because it weighs less. But there are also added benefits. It's easier for the horse to chew, and they find that it actually slows down their intake, so they don't eat quite as fast, which is good. Other things that you can do for forages, you can, certainly grass is very natural and takes less grinding than hay does. You can take hays with the minimum stem. You can take alfalfa cubes and soak them, and you have smaller fibers. And certainly you can try haylage, which is a fermented type hay. And those might be more easily chewed or ground by the older horse. There are a lot of senior feeds on the market, and so we talked about the density, and you need just to be careful about how much. Some of the senior feeds also will have supplements in some of the proteins that are in there that might help to build muscle, and so they've made a whole lot of different changes that might be more adaptable to the senior food. Back to the colic. So we have colic is a common reason for a geriatric to be presented to our hospital. Large colon impactions we talked about. The other problem is this strangulating lipoma. And the strangulating lipoma in the horse, you know, your dog, some old dog sometimes gets these little fatty tumors on their body. Well, the horse gets fatty tumors inside their abdomen. And unfortunately, this is a big one, and it can be on a stalk. So it kind of acts like a bolero, and it starts to wind itself around some of the small intestine and cause an obstruction, and it can cause some strangulation of that small intestine. This then is a surgical problem that you need to correct if you decide that you want to try and correct the problem. And the big question comes, do I send my 30-year-old horse to surgery for colic surgery? Is that a good thing or a bad thing? And so 50% of the horses over 20 who had colic surgery were discharged from our hospital, and 50% were euthanized. And they could be either euthanized on the table or after surgery if they didn't respond. So that's a lower percentage than a younger horse going to colic surgery would be. But it really is not because the older horse is not tolerating the surgery so much, it's the disease they have. So older horses are more likely to have a small intestinal problem, particularly the lipomas, than a younger horse. And small intestinal problems have a worse prognosis. So if I was a old horse with a colon displacement, he'd have the same good prognosis as a young horse would have. A young horse with a small intestinal obstruction would have the same bad or worse prognosis that an old horse would have. So it's the disease that you have that's more important, and the small intestinal lesions are more prevalent in the older horse. So let's go on to bones and muscles. Good news is horses are still being used for competition and pleasure riding in their 20s and 30s. And the bad news is that as you get older, your cartilages are more brittle and your tendons and your ligaments are less resilient. And so orthopedic problems are, if you have them as a youngster, they're going to probably just get a little bit worse as you get older. And so musculoskeletal problems was the second most common disease that we had horses presented to the hospital. And 37% of those were laminitis, and that is founder in the horse, and that was secondary to equine Cushing's disease. 55% of the lamenesses that we saw were due to degenerative disease, so arthritis, or problems with the ligaments and the tendons. So how do we work with the older horse and their orthopedic problems? These are not things that sometimes we can solve, but we can try to work on pain management. And the best way to work on a horse that is arthritic is actually to have them move more. And I often equate my own self. If I'm on the clinic floor and I'm working with the horses, I'm on my feet all day, and guess what? I'm not sore. When I'm off clinics, I'm sitting at a computer all day, and I try to get out of the chair and I can hardly move. And so the more you move, the more you can move. So these are not the horses that you want to necessarily be in a stall. If they can have a run-in shed and they can move around, that's great. The only thing that you need to worry about is social interactions. Make sure they're with buddies and not horses that can bully them, because sometimes they fall in the pecking order. So that's something you need to work on. And then you need to think about, if I'm still going to be riding this horse, what kind of exercise plan, how do I condition this animal? So the thing you need to realize is that it takes longer to get an older horse physically fit. So you're going to need to add some extra time. So if you're going to work with this animal in the spring and get them ready for a show or something, then you need to start working them a little bit earlier than you might the younger horse. They're also going to fatigue faster than a younger horse, so you need to rest them between strenuous exercise. Doesn't mean they can't do it, it just means you need to add in some rest periods for them. And as Dr. Pacheco said, the weekend warrior is probably the worst thing you can do to an older horse. Keep them in steady fitness is better. Low-level work more frequently is better than just going out on a long trail ride on Saturday, because then they're going to be sore on Sunday. You also want to decrease the pain, all right? Even though the things that we just talked about and mobility is important for decreasing pain, you're going to probably need to give them some non-steroidal anti-inflammatory drugs like phenobutazone. There's fibercoxib or Equiox, which is supposed to be a little easier on their stomachs, because if you take too many ibuprofen, you're going to get gastric ulcers or intestinal problems, and the same happens with the horse. So you need to be judicious and make sure that you can keep them comfortable at the lowest level that is as possible. You can also think about intra-articular steroids or hyaluronic acid. Glucosamine is used frequently for joint problems, and generally I would say the sooner you start them on that, as you start to see arthritis, the better, because it will not replace or build cartilage, but hopefully preserve what's there. And so other things that are available for pain, shockwave therapy has been used in hocks and tendons and appears to improve some pain relief. And then you can think about some of your alternative medicines, such as acupuncture, chiropractic, massage. I love it myself, so I think my horse probably would too. And so you can figure out what they respond to. Obviously, you're not going to cure the old arthritic joint, but you're going to make them feel more comfortable. This is Kizzy. Kizzy was one of our clients' horses, and they don't really know when she was born, but this was Kizzy at 1960. And so she's got to be at least 6 years old in that picture, right? And this is Kizzy at 1993, still jumping. And Kizzy, I think the last time I saw her was somewhere in 2005-ish area. And so she was well into her 50s, and she was unfortunately not with us still. But ponies do live longer than horses. And the interesting thing about Kizzy is people would see her and they'd say, obviously this person is 30 years old or 40 years old, and they say, well, Kizzy, I rode Kizzy when I was showing ponies in Lehigh or whatever. So the ponies get passed around quite a bit if they're good ponies. Immune system, good news is that older horses have been exposed to a lot of things in their lives, so they probably have higher antibodies against bacteria and viruses than the younger horses. The not so good news is that they don't have a good immune response to new organisms. So like when the West Nile virus started coming through, it really just came in 2001 to the United States, and they weren't exposed to it, so there was a higher morbidity and mortality in the older horses. So they may have more antibody production, but you still need to booster them on a yearly basis, because that's a big question. People say, do we need to vaccinate older horses as often as we do young horses, or can we go every other year? And really what they found is that you probably need to continue to do it on a yearly basis until we have more research. And the new vaccines for new diseases, you definitely need to do it, and perhaps booster them more frequently on the newer diseases. Heart, good news, it's not a frequent problem in the horse, but not so good news is that we do have this degenerative valve problem that appears more commonly in older horses, called aortic insufficiency, and it's only probably 2 to 3% of the horses, but it causes this very distinct murmur that your vet can pick up. It sounds like a cooing dove, so when you're listening with a stethoscope, you might hear this ooh, ooh kind of sound in the chest, and it sounds like this dove is trapped in there. And it's just caused by turbulence, and what you see, if you were to look at this horse on post-mortem, they have these little nodules. This is the aortic valves of the heart, and they become nodular. And so a murmur is just turbulence of blood. And so if you have nodules on your valve, it's obviously stirring the blood up more and creating this different sound. And so it's important that you pick this up early so that you can monitor how it's doing as the horse ages. A lot of times horses will live fine with this, and you can ride them just as you normally would, but sometimes it gets to a point where you're having congestive heart failure. The most specific disease in the older horse is the Cushing's disease, and the nice thing about this is that there's more and more research going on, and we actually now have another FDA-approved drug to treat it. The not so good news is that as the horse gets older, so this is 20 to 24, 25 to 29, 30 to 34, and above 34, you can see that the incidence of Cushing's increases with age. This little dip here is probably because this was in the hospital that presented to us, and we didn't see as many horses over the age of 35. In New England, our studies show that there's probably a prevalence of about 27% of the older horses develop PPID, and this includes not only those that have a positive diagnosis from their veterinarian, but when we ask owners about hair code, because hair code is the changes are the most predicted of the disease, that owners would say, yeah, you know, it seems to shed out less than other horses, or it takes 3 weeks longer to shed out than the other horses. And that shedding, or the problem with longer hair, is called hypertrichosis. And if you have hypertrichosis in your horse, you're 5 times more likely to have PPID than a normal hair coat. And it's 90% predictive that you'll find a tumor in the pituitary gland at first morning. And these are some horses. This is a horse that is really curly hair and long. This horse is having problems shedding out. This horse is interesting because she's shed out over her rump, but she has these long guard hairs which don't shed out. And this horse, mostly, it was on his neck area. Sometimes you get horses like this, and it's an older horse, but not that old, he's probably about 19. And his hair kick doesn't look that bad. I've got a jacket on, so it's winter time, or fall probably, because the grass is still green. And this is the time when we really want to catch these horses early, because if we can stop the growth of that tumor early, then maybe we'll have a longer, healthier life as an old horse. But by the time you see the hypertrichosis, you're in end stage, you know you have the disease. And so the challenge for the veterinarian is trying to figure out when the early signs are. And we're still working on that. New tests are being developed. The most serious outcome of this disease is laminitis. These horses are more prone to get laminitis or founder, and this is obviously can be life-limiting because of the degree of pain. They also have an increased susceptibility to bacterial infections and disease. So we see that this horse with the long hair has this wound that's not healing. And this is important because you're going to need to treat the horses with PPID for any infection more than you would a normal horse. So if I have a cut, I may not only have to clean and suture, I may have to put them on antibiotics, whereas maybe another younger horse, you just need to clean and suture. They get sinusitis. This is a horse that has tooth problems, and it's actually gotten into the bone. This is a CT of the horse's skull. And you can see that right in this area here is degeneration of the bone. And so it's chronic infections, they don't heal. We also know that horses with Cushing's will have higher fecal egg counts than age-matched controls. So older horses that don't have Cushing's have no problem with the higher egg counts, but the old horses with Cushing's will have higher parasite load. And after you deworm them, they will be reinfested faster. So a normal horse, you might say, oh, I'll deworm them and check them again in 6 weeks. and this horse you can probably check in 3 weeks. So as I said, the dilemma is trying to figure out early in these horses, and we're working on that now, but testing-wise, I use the ACTH test as my easiest and most reliable. If you have an old horse, and this goes for actually all old horses, but you want to do annual or biannual testing for all the horses over 20 to check to see if you can catch this as early as possible. And hopefully we'll have more early testing in the future, so keep your ears open. There's also a possibility that you may want to measure insulin levels, because as you probably learned last year, some of these horses are insulin resistant, and you need to make some carbohydrate reduction in their diet to prevent the laminitis. Full body clips, thorough treating infections and injuries aggressively, and good nutrition are important in the maintenance of these PPID horses. Pergolide is the drug of choice. It's Presend is the Boehringer Ingelheim FDA approved just in the last year. Seems to be a very good drug, and you can also get a compounded form, which is cheaper but not as reliable and can not the same quality control. What you're going to see with treatment is hopefully improved attitude, activity. PUPD is sometimes these horses will urinate and drink more than usual, and that should improve. And if they have hyperglycemia, which is seen in some of these horses, that should improve with this treatment as well. And long term, you're actually going to hopefully see some hair coat changes, increased muscle mass, maybe fewer bouts of laminitis, and a decreased infection rate. So it's a good drug. It's a disease that we should be intervening with if at all possible. And finally, I'd like to talk a little bit about the horse-human bond in the older horse. The duration of life of horses enhances the bond with the owners. And this is despite the fact that they may not be used for performance anymore, or they may not have reproductive capacity for even 10 to 20 years, and people have this bond. And it's amazing to me. I'll have someone come in with a horse, and she's obviously in her 50s, and she tells me that this is the first horse she got as a child. And I think that's, Anna said that I go with 2 age ranges, the foals of my love and the geriatric horses. And I think the thing that binds them together in my mind is that human-horse bond. If you have a newborn foal on the ground, instantly you're bonded to it. And owners will do whatever needs to be done to take care of them. And the same with these old friendships that we have with our geriatric horses. It's so hard to say goodbye to them. And so they go and expect the best care that they can provide. So we try to do as much as we can for extending life. And these are to identify problems that we have the ability to change. Now, some of the things we can't change, like the cataracts in the eyes and things of this sort. The heart murmur we can't really change. We can identify it. But we can help with the pain in the horse. We can help with the colic. We can help with the digestion by feed management and parasite control. And we can help with the immunity with the vaccines. So we want to help in that area. And it's very important, especially in the older horse, to think about an annual or biannual examinations, because things can happen that last year they didn't have Cushing's disease, and this year they're sky high on their ACTH levels, and I've seen that happen. And the fecal egg counts. So I usually recommend a thorough physical, annual and biannual, and that should include some blood work, looking for your ACTH and just your normal CBC and profile. You know, the profile gives you things like liver, how's your liver working, how are your kidneys working, fecal egg count for obvious reasons, and the dental exam. And again, it may not need to be floated every 6 months, but should be looked at to see if they have lost a tooth. And we treat the things that we can, so pain, PPID, dental disease, and good nutrition. And then we get to the point where in life you need to think about, is it time for this to end this life? And when people are questioned about what caused them to consider euthanasia in their older animals, well, first off, in a study that was done by NOMS way back in 1998, they said the most prevalent cause of death in the horse over 30 days of age, okay, month old, the most prevalent cause of death for the rest of their life is old age. Oh. And so they didn't define what old age is, but another study looked at the top 6 reasons why someone would choose euthanasia for their older friend. Lameness, chronic lameness, colic, chronic illness, acute illness, laminitis, and fracture. And the factors that really influenced people were hopeless prognosis, veterinary advice, and poor quality of life. Now the question is, what is quality of life? And it's hard to define in humans, but it's kind of can be boiled down to, am I happy? Do I feel good? And obviously you have good days and bad days, but on general you're hoping you have the best of the good days. In the horse it's a little harder to determine, but a lot of times we do it by, do they look healthy? Are they eating well? Are they moving around? So you need to kind of start to think in your own mind what you consider important in your horse's quality of life. So before you come to the time when you have to make some decisions, work out in your mind what you think is going to be important for that horse and his quality of life. And what's the most important change or improvement you feel you can do to improve that quality of life? And then you can kind of sit down and list 10, maybe not even 10 things that you think are going to influence your choice. Now sometimes it's taking out of our hands, like in the horse that has a strangulating lipoma where surgery is not an option. And that would be that acute illness that has maybe a poorer prognosis, and that might be an influence. The harder time is when you've just got this horse that's got chronic problems and you can't seem to get ahead of them. So these are things that you should think about now, so that when the time comes you have a baseline to remember what your animal's is like in the best quality of life. And this is my favorite set of pictures from one of my owners. So she had Werder's picture when he was 2 days of age, when he was 16 years of age, and then at 25 years of age. And so it illustrates the length of time that we can own these horses.